I've learned so much about the Infusion Center and travel and community work and documentation
and what went on behind it. So
it takes a whole team.
Hi, I'm Cassie, and I'm an infusion nurse at Boston Children's Hospital.
Hi, I'm Erin. I'm a cardiac ICU nurse at Boston Children's Hospital.
Hi, I'm Mary. I'm a home parenteral nutrition nurse at Boston Children's Hospital.
Hi, I'm Tina. I'm a clinical documentation integrity specialist at Boston Children's.
I've been at Boston Children's since 2008. And so I was interested in global health, and I became a global health nursing fellow. And now what I do is I travel to Bangladesh, and I teach the nurses there CPR and cardiac anatomy. I do monthly virtual educations as well with them, and I started out with 7 nurses, and the last virtual education I had over 50.
Oh, wow.
Yeah. Vietnam, Bangladesh, and Ghana all Zoom in while our nurses are also learning. So they're all learning together. And I think that it's a great thing for our nurses to learn about, that there are nurses in other parts of the world doing what we're doing with far less resources at their disposal, including education.
I do a lot of education for families going home with a life-sustaining therapy. And so I kind of came up with a 5-session education program where we build, how do you set up the home? We bring in anybody we can to be involved in the discharge process, and the parents start to become more comfortable, and they work with the bedside nurse with each additional step.
So you're taking something very scary, something, a lot of kids don't like dressings coming off. They might be crying, they're scared, but the parents are learning how to include the child in the change, the dressing change. Yeah.
We try to encourage the families to be creative with the dressing changes, but when they come back and teach me and they ask me to be their assistant, then I know.
That's fantastic.
In the infusion clinic right now, we are all learning to use the ultrasound machines. So you can actually see the vein and you can see the needle going inside the vein, and nothing is guaranteed, but it makes it a little less traumatic knowing that machine is there and knowing that it could be a one poke appointment.
That's
actually learning.
Fabulous.
Yeah.
And that really helps our patient population as well. It makes their visit to Boston Children's, it really does.
Yeah.
It makes or breaks it. So having you, it really makes it.
As a nurse, you have so much impact on people's lives, and sometimes we don't see that. We're unable to measure it unless they come back and show us and see that. So my current job, I'm no longer at the bedside. But the way I have my impact is to make sure that the quality of care that the nurses and the physicians give every day to these patients is more accurately reflected. That's why I'm attracted to this job. I love this job because I'm a detective and I get to have an impact on the hospital that way.
As you, I think, grow as a nurse, you start to realize all the opportunities you do have. And you really could do you can do anything with nursing. You don't have to be at the bedside. There's really unlimited possibility.
I was instrumental in creating a sim experience for the patients. So it's a simulation over in the sim lab for adolescents and young adults that are learning to take care of their central lines themselves. So we're creating scenarios for that.
Oh, that's
That's kind of a process to, get them to self-care.
One of the reasons I was attracted to nursing, you can find your niche, that spot that feels right to you.
I almost felt like I was getting stagnant, and I wanted to continue to grow. So I did make that move to go into inpatient med-surg nursing. I am part of a new initiative that the unit recently started, where people who are confident using the ultrasound machine being paired up with someone who's just getting started. And I know for myself, I have learned so much by teaching, so it helps both parties by doing it over and over again. That's kind of how you build the confidence and you get better.
You are a master of your skill, I can tell. And I would want you to mentor me, so yes.
Well, working in the ICU, we see the kids come out of the OR and they're sedated, and we get to know the family, but it's at probably their most stressed period, and they take the time to send you letters or notes, and they remember you. That, I think, means a lot.
We do remember. My child was in the cardiac ICU, and Kirsten was our nurse right after the coming out of surgery. And it's just that person holds your hand, walks you through this like traumatic time.
You get
so
thank
much.
yous in so many different ways too throughout the hospital. They'll say, "Oh, I couldn't have done it without the ICU nurses." Like, we hear that thank yous for you. And for me, the biggest thank you is if I'm in the lobby of the hospital and one of the kids comes running up and says, "Mary," and almost knocks me over with a hug. That's beyond a thank you.